Steve is the director of the Office of Rare Disease Research in the National Center for Advancing Translational Sciences at the National Institutes of Health. His major focus is on stimulating research with rare diseases and developing information about rare diseases and conditions of healthcare providers and the public. To help identify research opportunities and establish research priorities, the office has co-sponsored over 1,200 rare disease-related scientific conferences with the NIH research institutes and centers and with the extramural research community, including patient advocacy groups. So we are so excited to have you talk to us. There you go.
Thank you, Wendy. I'm not sure if these are the right slides. I lost some slides between here and Washington, or between Washington, D.C. and here, so we'll see how all of this goes. Okay, we're going to talk a little bit about rare disease. I'm sort of the setup guy for what's coming on in the next several sessions of the meeting and everything, so we'll give it a go. Try to move these forward. So here are the perceptions that we're dealing with. Okay, coming up in the back, all right? Better. Thank you. If I drop the mic, holler and I'll be ready to go. So here are the perceptions that we've been dealing with for many years and what we're trying to overcome. Very few people have the condition, the rare disease. There's little or no information available, little or no research interest. No treatments are available. And this doesn't mean drugs, biologics, or other interventions. Sometimes it's just quality of care, good clinical care, good care of the patients and the families. Limited access to rare diseases-focused clinicians, and little or no hope for the future. I think they're the things that we've been dealing with since probably the 1970s, before the Orphan Drug Act that occurred in 1983. This is the 30th anniversary. And I think if people were to look back in the early 80s and where we are today, it's rather phenomenal. Those of you who've been around since those days, you can just see tremendous advancements. But yet we still have many of the very, very similar problems. Getting the diagnosis, getting good care, learning where the practitioners are who know about our disease, trying to interest the research community. So all these perceptions in some respects are realities. They may not all be applicable to you, but they are. They do occur, and we have to keep dealing with them. So my apologies, because I know some of the slides were not the ones that I had put on, but that's okay. So in this session, I don't know if all of you all started talking at one time on the last session, but sitting up here in the front of the room, it was like this tremendous blast of voices coming up to us. And it was amazing. But I think it really shows you how much you want to talk and you want to be heard and how much you want to share. And that's very, very important, I think, as you go along. Can you see the slides over here? I'm sorry. You're good? Okay. More better, right? I think that's what they said. Okay. I think my English teacher would have loved that. And I won't spend too much time here because you've gone through a lot of this already. What we're trying to do and what you're trying to do is gaining access to knowledgeable physicians and other healthcare providers who understand your disease and how to deal with it on a daily basis. Thank you. That's it. I take my cue. Enough said? Okay, no, we'll move forward. For those of you who are in the audience watching this, if you didn't hear the fog horn, the horn from the ship backing out here, that was what that was. Okay. Knowing there are other families living with the disease and avoiding stigmatization, a major, major issue, and we particularly run into this with the kids as they go through it. It's something we have to encourage. Look, and that's why I think we try to really link up the patients and the families together. I think finding a safe person or a person who you feel safe to talk to, whether it's another parent who has a child or another patient with the same disease, very, very important to be able to raise questions, to talk, and sort of find out where are we going and what is the likelihood, what are the things that are going to happen here and how do I deal with them on a day-to-day basis. And I think that helps out quite a bit. We also find that not everyone is ready to obtain, lots and lots of information at a one time. It sometimes is gradual. Everyone can't absorb all the information about the disease all at one time. It's rather difficult. Some can, many cannot. So we try to provide these building blocks to enable the decision making to occur. The other major issue is the understanding the whole process of the disease, going from life as we knew it and going from life as it's going to be. And this is really difficult because you're entering into a total unknown when you get that diagnosis. And so I think the importance of working with each other is so critical and learning about the disease as you go along. The last bullet is meeting patients and families where they are and not try to rush them to where we, as leaders of the patient organizations, where we want them to be, but where they really are. I think we all have to have that understanding of what we're looking at as we go on. So those of you who've been around for several years, especially the last 3, 4, 5 years, you notice a tremendous increase in rare diseases. And I would say much of this is directed towards you and what you've done to inform the community being the healthcare providers, the media, the research investigators, both the basic and clinical researchers, so that we're really starting to see the opportunity to improve patient recruitment. We're seeing expanded roles of the patient advocacy group, and especially as we develop public-private partnerships. So a few more of the reasons for getting increasing the interest in rare diseases and orphan products. I think we now have some good models to interest the pharmaceutical industry, even to taking the rare diseases, studying them, and trying to get products more readily out to you. Quite a difference than what it was 10 or 15 years ago, especially when you look at the consolidation of the industry that has occurred. A lot of activities related to the repurposing of approved and investigational products, and you're going to hear a little bit more about drug development 101 today. And you'll find that, for the most part, the companies will pursue one indication for one drug immediately. And so we're looking now at better ways of repurposing, defining more uses for the product. We're seeing expanding federal, national, and international interest and support for the rare diseases. And there's an organization called IRDIRC, the International Rare Diseases Research Consortium. Tremendous number of activities there. We're also seeing through some of the translational research activities the development of more directed research agenda leading to interventions and diagnostics. And as a result of a great deal of funding, although we are looking at some, we have experienced already because of the effects of sequestration, a reduction in scientific research. And so prior to the last couple of years that we're looking at and coming up in the future, the increase in scientific opportunities as a result of the increased research, particularly with the rare diseases. Okay, so you can see here at the heart of all this is the patient advocacy groups and the various groups who they interact with on a regular basis. And we were talking about why you feel tired and lacking energy. Right there's your slide. You're asked to interact with all these organizations. And I know how tired I am at the end of the day, even though the day seems like it never stops. I guess the one good thing with coming to California, I can finally rationalize to my wife why I get up at 4 o'clock or 3:30 and do work, and she accepts it. So it's sort of good at the time zone coming out of the Eastern Zone. But you see, all those interactions, and that's what you're being asked to do. And I think looking at the skills that you obtain, you're $1 million people, $5 million people. And if there was a $6 million man or woman, you would be it. Because these are all required as you go through. You're going to be working with reimbursement agencies, other philanthropic foundations, the research groups, the regulatory groups at FDA. And you keep going around the circle, industry, medical specialists, the academic researchers. And so you're worn out. But they do pay off. So you have to continue to look at where's my energy go, how do I work with the folks, and try to find lots of people in your organization who have skills that can help you interact also with these organizations. That's so important as you go along. So some of the tasks of the patient advocacy groups, and I'm not going to go through these. I just will, because really the other slide sort of pushed that information to you, and just sort of read these slides. They'll be available, and please give our office a call if you have any questions at all related to any of these slides or any of the other activities that we can help you. Because as we'll see, one of the most important things going as far as research is for you as an organization to know who the program people are at NIH and at FDA that you should be talking with and other federal agencies. It's so important, and we can help you with that entree into the system. So we won't spend too much time. And you can see now the difference, the evolving roles of patient advocacy groups. And so more and more the global relationships, the partnerships, they are essential. We're finding a great deal of activity in many, many parts of the world, Europe, Australia, Japan, Korea, just a lot of activities up in Canada. So we have to get you to know who the other people are around the world that you're working with or should be working with, including the researchers. And that goes for research networks and consortia as well. So it's a lot of information. We're asking you to help develop patient registries and natural history studies. And if the slide comes up later on and doesn't have a full circle, we'll talk about that a little bit more. But the last bullet there, expanding the knowledge of translational research resources and opportunities, particularly there at the NIH. So many different activities are ongoing. Normally, we fund about 9,400 research projects on rare diseases every year. So that's about $3.6 billion out of the $30 billion a year research budget. And there are about, I guess, 1,600, 1,800 different orphan product studies that are ongoing. So it's a lot of work, but it may not be meeting your needs, and we'd like to hear about that too. So there's a circle, and I'm really only going to focus on this one part here. Excuse me, Wendy. And I don't know if you can see this. The patient registry part up here, the biospecimen repositories and natural history studies. That's what we're sort of looking at, because we know pretty good and pretty well how to generate the research hypothesis, how to do clinical trials, and we're learning how to do clinical trials in small populations even better now as we go along. We do the intervention, and then more and more FDA is looking at phase 4 or post-approval studies required for the orphan drugs. And so what we're asking you is really to look at these patient registries, natural history studies. And so I think Kyle Brown is here, he's going to, and others will talk about patient registries later on today. So pay particular attention, and there are a lot of caveats that you have to look at, but there are some good things that we're working on. And I think what we have to do is really looking at patient registries, and again, the acceptance and use of common data elements for all diseases, looking at unique data elements for the individual diseases, specific questions, and all these other activities here. And if you do develop a patient registry, make sure it's registered with the HRQ, Registry of Patient Registries, the Roper group. So we're trying to encourage folks that develop registries to sign up for that activity. Real briefly, the Research Network, the Rare Disease Research Network, and this is competed. This is still undergoing competition right now. It's open till around November 7th. You can see the various groups, and again, this is where we feel the collaboration is really starting to pay off. We've never had the opportunity to gather a number of researchers, dedicated researchers, multidisciplinary research teams for most of the rare diseases. And here's about 17 different organizations of diseases, kidney stones, the porphyrias, urea cycle disorders, and so on. So many, many different groups. We involve the patient advocacy groups extensively in the activities. Have a training program in natural history and pilot clinical studies. So I am running out of time, and I want to sort of move through these things very quickly. Our office, the Office of Rare Diseases Research, here is the announcement about the funding opportunity announcement that has been published. And just if you get the slides, you can look at this. Rashmi Gopal Srivastava from our office is responsible for this. Yafa Rubenstein from our office does the patient registries and biospecimen repositories. And there will be a pre-application meeting. If you have an interest and you're able to listen in or watch on September 25th, it's coming up next week, we'll be video casting this. So please take a look at it. And it will be archived if you can't make it. But that will be where there will be a lot of discussion. Some of the newer activities of our office, we're looking at the prevalence of rare diseases, looking at what is necessary, doing needs assessment for pediatric and adult medical devices. We're working with the National Institute of Environmental Health Sciences to talk about gene and environment interactions, and also a big, big issue, animal models for rare diseases. And since we have been moved into the National Center for Advancing Translational Sciences, there's a huge network of research centers throughout the United States called CTSA, the Clinical and Translational Science Awards. It's about 61 different major medical centers primarily focused on clinical research. And so we have to sort of look to see how our research network can begin to utilize the resources and services and facilities of this CTSA program. And here were some of the translational research resources. I'm going to just go through these I won't even talk about them too much, just to know there are programs that you read. You know, Washington and government is a lot of acronyms, the alphabet soup. But you want to read about trend and bridges, you know, NeuroNext, NCI, National Cancer Institute's NEXT program. They have various resources that are useful, but you have to know who they are and how to work with those organizations. Some more allergy, infectious diseases, and National Institute of Child Health and Human Development. They've got the Best Pharmaceuticals for Children Act that makes sure that we're able to get indications if a drug has already been approved for adults, that studies can be done in kids to further that use in those. So, and at the last set of small business grant awards, again, there are set-aside funds for small businesses to get awards to do research for some type of opportunities that will stimulate industry, stimulate business by developing technology. So I can keep going, but there's the last slide is our staff, and probably if you Google any of the folks, or you can come up with the contacts with them, and please feel free to contact them at any time. We're generally available for your inquiries. And we do have an information center that I didn't put in on the slides called GARD, G-A-R-D, the Genetic and Rare Diseases Information Center. That's staffed primarily by genetic counselors. And so I think sort of look at that. If you have questions that you can't get answered on your own, please go to them. I think the big difference in 30 years ago, you have the internet and the web searches that are available. I think it was mentioned in the last session too about the Facebook connections and other folks. We still feel very strongly of the need for strong, knowledgeable, and leaders for the patient advocacy groups to make things happen for the rare diseases. And you're the ones that will keep things moving. So I will end it with that. I'll be around the whole day tomorrow. If you have any questions, please catch me. And I know there's break, lunch, and that other thing at the end of the day. Cheese, I think it is, right? We won't say the other thing. I don't say that. So thank you very much. And I can never really thank you enough for what you do and providing the leadership for the country, for the world. You are so important. We just cannot thank you enough. And all the efforts that you make to really keep everyone focused. And you have 6,500, 7,000 diseases, and we haven't even started looking at all the mutations that will have that occur. And so you're very, very critical to what everyone is trying to do. So we're trying to help you get to where you're after, and that's a cure or a treatment for your disease or the disease of a child in your family. So I will end with that, and thank you very much.